I had my septoplasty surgery recently with a couple of other operations thrown in at the same time. And there's a few tips I'm just going to share here. It would have been really helpful for me to have known these things before going to surgery. I had called the surgeon's office up a couple of times and they'd called me a few times. So we had about 4 different conversations, myself, with people who work at the office about any questions or concerns I had. And anytime we were on the phone, I asked the same question: is it definitely okay that I bring my CPAP with me and that I will be able to fall asleep using my CPAP after the surgery, even the night of? And everyone I spoke to said, yeah, that's totally fine. Even a surgeon that I talked to on the phone before going in. And then on the day that I went in, literally all of the nurses that I brought this up with were like, oh, who told you that? No, we want you to go 2 weeks without using your CPAP machine. Even the surgeon who operated on me, who I spoke to the day of, said, yeah, we want you to sleep without your machine for 2 weeks, and no, you won't be able to use your CPAP afterwards. That really pissed me off because I felt like I'd gone to so much effort to research everything and check everything, and people from the hospital told me that it was okay. So I did find some kind of workarounds to deal with this issue. If you have sleep apnea like I do and you rely on oxygen throughout the night, then my first big tip is to get a CPAP mask that is quite a bit bigger than what you're used to. In my everyday life, I use this mask, so it fits over my face like so. And for the time that I recovered, I got a much bigger mask. I mean, when you compare them, I guess they don't look dramatically different, but when you're actually wearing it, this sort of, it's just quite a bit bigger. I'll show you. The size difference is really dramatic when you're wearing it. The actual length that it extends out from your face is a lot further than what my other mask allows, which is really important because the oxygen is going to be coming through this hole. And if you've got a bunch of like packing and bandages right here, when you've got a mask over your face, sure, the mask might actually fit, but then you've got, you know, this thickness of bandage right here that's just blocking the airflow. So even if I could have cut down my bandage really small so it fit here, the first few days I had to make it pretty thick to catch all of the blood overnight, so I really needed a bigger mask. What I'm trying to say is, if you're getting this surgery, before you actually go in, go to a place where they hire out CPAP masks. Find one that's compatible with your machine, you know, bring your machine in, and then get the biggest one you possibly can that will still fit your face. My other tip is, when you first come out of surgery, your bandage might be a bit different to mine, but I got ones like this that you can just cut to your size that you want, and then you use medical tape to stick it on your face. I had to have it pretty big at first, probably a bit bigger than this really, but using this as an example, it's this shape. Let's say you've got a bit of thickness. If you've got lots of thickness, it's going to kind of stick out like that. But when you stop needing so much thickness, I ended up graduating to a size like this, just a single layer sort of thing. In fact, it was probably even more of a square shape than anything. But once there's not all that bulk, you can just place it against your nose and try and push it inward so it's like really sitting against your nostrils like that. If you can do that, there's just going to be so much more room for the air to flow into your mask. Even if these are things that you follow before your surgery, I'd still really suggest trying your best to get a couple of really good night's sleeps before your surgery. Unfortunately, I had way too much going on. Way too much to worry about, and I barely slept for a couple of days before my surgery. And I really think that if I had have had a few good sleeps, it would have really helped me recover for the first few days. And even if you've done everything right, you might still have other problems separate from sleep apnea that you're dealing with the night of, like, when you've had surgery. I was very nauseous. I had blood coming out of my nose constantly, blood coming out of my throat. I just was in no state to really go to sleep, even if I had have had my mask, because I was very on the verge of puking constantly. Hopefully that helps though.